So here we are, living in times that we otherwise wouldn't imagine, thanks to Covid-19. Since the virus has emerged, it has steadily killed thousands of people per day all over the world, or 1.2 million total. The economic consequences of the pandemic, or at least those that we've seen so far, constitute the worst economic crisis since World War II. Yet, there is a reward at the end of the road: the vaccine. The development of an effective vaccine is never an easy task. However, all indications currently suggest, given the unprecedented extent of scientific effort, that it is indeed coming. The 9 major manufacturers that have managed to enter the third phase of large-scale efficacy and safety trials are about to enter regulatory review by mid-November, meaning that, if everything goes as planned and the vaccine is indeed safe and effective, it will be granted the necessary use authorization for general public by the relevant authorities by the end of 2020. Now, does the existence of a vaccine mean that we are already safe? Most probably not, since then it will be the time when the marathon begins. The marathon of manufacturing and distributing billions of vaccine doses until the last person is vaccinated. That's right, the last one. This is why experts have said that the fast distribution of a vaccine will be an even greater challenge than the development itself. Now, one aspect of the issue is the logistical challenge we have to overcome, while the other aspect is the ethical challenge we also have to overcome. This challenge presents a range of questions, including which countries should get a vaccine first, to what extent should we prioritize helping the poor, minorities, or the elders. Would it be better to prioritize how many lives are saved or how many life years are saved? For instance, is it better to vaccinate more old people in the beginning to make sure fatalities are as low as possible in absolute terms, or go for younger people first to make sure more quality life years are gained in the long run? But let's dive into some of the major proposals currently on table by policymakers to see which one, from an ethical perspective, should be employed and why. The COVAX facility, led by the World Health Organization, has proposed to give countries vaccine quantities in proportion to their populations until each country can help 20% of its population. This applies mostly to developed economies though, since poor countries will be given only the necessary quantities to cover essential workers before donors vaccinate 20% of their populations. Another proposal, also by the World Health Organization, but this time with more quality characteristics, aims to prioritize healthcare workers, elderly, and the most vulnerable. It would seek to reduce COVID-19 deaths and protect health systems by giving countries vaccines based on the number of essential workers, the proportion of people over 65, and those who are likely to suffer seriously if they get COVID-19. The last and perhaps most interesting approach proposed by academics, the fair priority model, tries to limit economic and health consequences. Academics argue that at least after countries have their pandemics under control, fair allocation requires distributing the vaccine first to those countries where it is possible to save the greatest number of life years, then considering also disability that can be prevented by the vaccine, as well as the amount of poverty and aggregate economic damage the vaccine can prevent, and finally, distributing the vaccine to reduce transmission rates as far as possible. The world has come across such challenges in the past with Ebola and other infectious diseases. What will be chosen as the optimal solution remains to be seen. However, it is important to make sure that access to the vaccine takes into account both economic and health effects, as well as equally prioritize countries who lack the ability to provide care. Ethical considerations apply not only to the effective and efficient distribution of the vaccine, though. Involving politics in the procedure raises another issue. The independence of the FDA or any administration responsible for the authorization around the world is vital, both because it facilitates trust among citizens and because its decision-making is not clouded by political pressure. Indicative of this lack of trust is the recent survey conducted by Kaiser Family Foundation, according to which 62% of Americans believe the Trump administration will put pressure on the FDA to approve a vaccine that isn't necessarily safe and effective, while 39% think that the FDA is giving too much attention to political considerations instead of just focusing on science, the driving force of change and advancement that keeps us safe and healthy. If you enjoyed this video, don't forget to like and subscribe to support our content and share your thoughts in the comments.